Coughs are one of the most common symptoms of childhood illness. A cough can sound awful, but usually isn't a sign of a serious condition. In fact, coughing is a healthy and important reflex that helps protect the airways in the throat and chest. Catarrh is a buildup of mucus in an airway or cavity of the body. It usually affects the back of the nose, the throat or the sinuses, air-filled cavities in the bones of the face. It's often temporary, but some people experience it for months or years. This is known as chronic catarrh. Catarrh can be a nuisance and may be difficult to get rid of, but it's not harmful and there are treatments available. Congestion is a common symptom in children. Sometimes congestion is an acute, or short-term, condition, such as in the case of a cold or the flu. Other times nasal congestion is a chronic problem, such as in the case of allergies. In order to fully resolve nasal congestion in children, it is important to identify the underlying cause, as well as to treat the symptoms. Nasal congestion is often caused by the swelling of the tissue lining the nose due to irritated and inflamed blood vessels. 1. Elderflower. Botanical name, Sambucus nigra. Although poorly researched, elder is a safe and effective domestic remedy for ear, nose, and throat problems, whose traditional use in Europe goes back to pre-classical times. The reamy white flowers are often collected to make wine, but the tincture or hot infusion are therapeutically more effective. Parts used: flower, fruit. Actions: Anticatarrhal, anti-inflammatory, antioxidant, antiviral, diaphoretic, stimulates sweating. Best taken as infusion, tincture of flower, tincture, extract of fruit. Elderflowers make an excellent cooling infusion for cold symptoms, flu-like colds, and mild feverish states by easing symptoms as well as countering infection. They combine well with yarrow, Allium oleifolium. Drink the infusion hot, sweetened with honey. Ripe elderberries contain high levels of vitamin C, and contain strong antioxidants. Take elderberry syrup or extract to counter infection and speed recovery. A recent clinical trial found that elderberry extract shortened recovery time in people suffering from influenza. In either form, the berries can be taken to improve resistance to infection and reduce a tendency toward recurring colds, sore throats, and coughs. Elderberry extract is available as an over-the-counter remedy, and can safely be given to children. Elderflowers can dry and tone mucous membranes lining the nose and throat, reducing sneezing, itchiness, and a runny nose in conditions such as allergic rhinitis and hay fever. Combining elderflowers with nettle, Radica dioica, is more effective in such cases. Elderflowers are often used in chronic catarrhal problems affecting the sinuses and the middle ear. In combination with other remedies, the flowers are also useful in treating chest infections such as bronchitis and pleurisy. Elderflower tea, taken hot rather than cold, is thought to act as a diuretic, stimulating urine flow. It is traditionally taken to relieve rheumatic aches and pains. A cold elderflower infusion can be used as a wash for sore and inflamed eyes, including conjunctivitis. Mildly astringent, it is believed to relieve skin conditions such as acne, eczema, and psoriasis. Dosage for adult, 5 to 15 grams a day, or 100 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions, none known. 2. Thyme. Botanical name, Thymus vulgaris. A classic kitchen herb, thyme makes a refreshing tea that counters infection and tones the respiratory system. Useful in almost any problem affecting the ear, nose, throat, and chest, thyme disinfects the air passages, soothes coughing, and stimulates clearance of phlegm. Parts used, aerial parts. Actions: Antibacterial, Antifungal, Antioxidant, Expectorant, Relaxant, Tonic. Best taken as infusion, tincture. Thyme tea, with or without a spoonful of honey, is an excellent home remedy for ENT problems, including colds, catarrh, sinus congestion, sore throat, and tonsillitis. The tea can be used first as a gargle and then swallowed. Thyme brings relief to all manners of cough and chest problems, and can provide valuable support in asthma and whooping cough. It is often combined with licorice, Glycyrrhiza glabra, and Echinacea spp. The tea may be taken as a general tonic, as well as to relieve indigestion and gas and to treat threadworms. In arthritic and rheumatic conditions, it makes an invigorating addition to a bath. The essential oil can be applied undiluted to fungi-infected nails. Use 1 drop per nail twice a day, do not use undiluted elsewhere and do not take internally. Thyme is seen as a longevity herb, a view supported by evidence that it prevents the breakdown of essential fatty acids within the brain. Dosage for adult, 2 to 4 grams a day, or 30 grams per week. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 rod the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: rarely, may cause gastrointestinal upset or allergic reaction. 3. Garlic. Botanical name, Allium sativum. One of the world's most important medicinal plants, garlic is also one of the most researched, with over 1,000 published papers investigating its therapeutic activity. Folklore has it that garlic protects against the devil and vampires, beliefs that attest to its power as a medicine, particularly in countering infection. Part used: clove. Actions: antibiotic, antifungal, blood thinner, counters cough and respiratory infection, lowers blood pressure, lowers cholesterol levels, supports beneficial intestinal flora. Best taken as fresh raw garlic. Before modern antibiotics became commonly available, garlic was one of the most frequently used remedies to treat infection. In World War I, it was used to dress battle wounds. Although we have far more potent antibiotics today, garlic still has a place in treating infection. It makes an excellent remedy for all types of respiratory infections, including sinusitis, cold, flu, sore throat, cough, and, more specifically, bronchitis. Swallowed whole, 1 small clove, eaten crushed in with food, or taken as a tablet, garlic will strengthen the body's ability to fight infection and speed recovery. A simple and effective kitchen remedy for colds, sore throats, and coughs can be readily made by mixing a crushed clove of garlic with freshly squeezed lemon juice, citrus lemon, 1 to 2 teaspoons of honey, and a pinch of dried ginger, Zinniber officinalis, powder or, preferably, a small piece of chopped fresh ginger root. Place in a mug, add hot water, and stir. Drink up to 3 cups a day. Garlic may be taken alongside, and is likely to complement prescribed antibiotics, at the same time warding off possible side effects by helping to protect beneficial intestinal bacteria and reducing the chances of developing thrush. Applied consistently over several weeks, fresh garlic or garlic oil may prove successful in countering local fungal infections, such as itchy ear passages and warts. Despite its varied uses, garlic is today most valued for its positive effects on the circulation. Taken long-term, garlic helps to prevent atherosclerosis, furring up and narrowing of the arteries, thins the blood, and supports better cholesterol levels. These effects promote a more efficient circulation through the arteries, support a lower blood pressure, and reduce the risk of heart problems. When taken long-term, garlic also has a firm reputation as a preventative against cancer. To make garlic oil, crush or finely chop 4 large cloves and place them in a small non-stick pan. Add 3 tablespoons of organic olive oil. Heat gently until the mixture is just simmering, then simmer for 1 to 2 minutes, stirring constantly. Pour the contents into a glass jar and leave to cool. Strain, bottle, and label. Use within 12 months. Dosage for Aldit: long term, 1 clove a day; short term, up to 3 cloves a day. Manufactured products: take product at manufacturer's recommended dosage. Dosage for children. From 6 months to 1 year, give 1/10 th the minimum adult dose. From 1 to 6 years, give 1/3 rod the minimum adult dose. From 7 to 11 years, give half the minimum adult dose. From 12 to 16 years, give the low adult dose. Cautions: if taking anticoagulants, blood thinning drugs, such as aspirin, take garlic only on the advice of an herbal or medical practitioner.